Hi, my name is Kathy Mers, and I'm with Kathy Mers Insurance, and I've been helping the owners of Growing Seeds put together an employee benefit package for you that will be effective on July 1st of 2017. Please note that if you are already on the Kaiser coverage, we still need you to fill out a new enrollment form for the new plan on July 1st. Inside of your Kaiser envelope are the information that you'll need to follow along during this enrollment video. I want you to take all of the papers out, and we're going to start with the Kaiser enrollment form, the salary reduction agreement, and the contribution worksheet. First of all, Growing Seeds is going to be sponsoring 50% of the employee-only coverage for both medical and dental. You'll see illustrated on the contribution worksheet what the employee cost is to Growing Seeds. The amount that they're going to pay is listed in red, and then the balance outlined in yellow would be what would come out of your paycheck on a monthly basis. In order to help you, we've decided to put in a salary reduction program or a Section 125 program so that you can have that money taken out of your paycheck pre-tax. Please make sure that you fill out this form called a salary reduction agreement, sign it, and turn it in by Friday the 23rd of June. In addition to allowing you to come on the plan yourself, you can also bring on a spouse and children, or just children. And all of those rates are listed under the columns on the contribution worksheet. Again, all of those amounts can come out of your paycheck on a pre-tax basis, and please note that all of the figures on the sheet are monthly. In addition to the salary reduction agreement, we will want you to fill out a Kaiser enrollment form. The Kaiser enrollment form looks like this. The side of it can be ripped out, off, and recycled. You need to focus on filling in at least Section A, which is your employee personal information. If you're going to add dependents, you would put that down in Section B, and then you would sign the bottom and turn that in by Friday, June 23rd. In addition to that, there's a gray section. Please don't worry about filling that out. Either Carrie in Human Resources or my office will fill that out and make sure it's done appropriately. I'm going to have you put the enrollment forms and the contribution worksheet aside, and I'm going to have you pull out 4 things from the Kaiser envelope: the summary of medical benefits with a blue stripe, the alternative care benefit sheet with the 2 people on the front of it, the dental summary with the green bar on it, and then the dental brochure has a gentleman talking on a phone. We're going to start with the medical benefit summary. Not unlike the current Kaiser coverage you have, we will be offering one plan starting July 1st. This plan allows you to see anybody inside of the Kaiser service area for pretty much just a copay. There is a deductible associated with this plan, and there's also an out-of-pocket, and I'm going to describe what those mean. If you look at the second line labeled out-of-pocket maximum, you'll see the figure $4,000 for one member. That's the maximum out-of-pocket in a calendar year that you would pay if you had a complete catastrophe. Any money that you spend out of your pocket goes into that $4,000 bucket, so to speak, and if you ever fill it up during the calendar year, you would have 100% coverage for the balance of the year. On 12/31, the bucket dumps out and it resets itself on January 1st. If you go into a doctor and pay a copay, if you have a prescription filled and you pay a copay, or if you have to go into the hospital and it's subject to the deductible and then 20%, all of that you were spending out of your pocket would go into your bucket. If you look at the third block of services, you'll see that all types of office visits are covered at what's called just a copay, a flat dollar amount. You can go in for a routine physical and it's covered at 100% based on your age and your gender. You can go in for a primary care visit and it costs $25. That $25 would drop into your bucket. You can see a specialist for $35 and that $35 would drop into your bucket. Or you can go to an urgent care center for $45. In addition to that, certain preventive tests are covered at 100%, and certain lab, x-ray, and then large imaging tests like a CAT scan, an MRI, or a PET scan are covered at a flat copay. Again, not subject to deductible, flat copay, and the copay would go towards our $4,000 bucket. In the middle of the page, it describes medications. Kaiser's program runs on a 3-tier system, so your drug would be categorized as generic, preferred brand, or non-preferred brand. Based on that categorization, you would pay either a $15, $30, or $50 copay. If you're on a generic medication and the cost of the generic is less than $15, you would pay the lesser of the copay or the actual cost of the drug. In addition to that, Kaiser offers mail order drugs. You can get a 90-day supply for essentially 2 copays, and you can set that up so that you can do it online and then it can be mailed to your house. If you look at the bottom of the page, it talks a little bit about hospital services. These are what I call the big ticket items that would be subject to the $1,000 deductible. If you take a ride in an ambulance, go to an emergency room, or need to be admitted for an inpatient hospital stay, or if you're even having outpatient surgery, all of those things are subject to the deductible and then 20%. So for example, if I went into the hospital and the bill was $10,000, I would pay the $1,000 deductible first, and then I'd be responsible for 20% of the bill or the balance. Again, any deductible or 20% I pay goes towards that $4,000 out-of-pocket maximum. If you flip over to the back, it outlines skilled nursing facilities, chemical dependency, and mental health services. All of those things are covered on this plan. I'm going to focus a little bit on the next 2 benefits, the alternative care and the vision services. The alternative care benefit includes acupuncture, chiropractic, and naturopathic services, in addition to massage therapy. Kaiser doesn't employ any of those types of providers in their facilities, so I'm going to have you pull out the alternative care benefit flyer that's from the packet. This talks about the relationship that Kaiser has with a group called the CHP Group. It's a network of alternative care providers. There's instructions on the flyer on how you can look up online or call to find providers in your area. As long as you see providers in the CHP network group, you would have the coverage that Kaiser illustrates on the benefit summary. You can see an acupuncturist, a chiropractor, and a naturopath for $25, and you can see a massage therapist for $25. There is a 12-visit limit on massage therapy, and then there's a $1,500 benefit maximum on all of the services combined. The benefit maximum is basically the money that Kaiser will spend out of their pocket on you for these services. So if I went in for a chiropractic visit and it cost $100, I would pay my $25 copay. Kaiser would then pay their $75, and their $75 would go towards eating away that $1,500 maximum. In addition to alternative care, the plan also covers vision for both children and adults. An eye exam that's routine is $25, and then every 2 years, Kaiser will give you a $150 allowance towards lens, frames, or contact lenses. The thing you need to remember about the vision program is all of the services need to be provided by Kaiser vision providers inside Kaiser facilities. I'm going to have you pull out the sheet that has the green bar on it, which are the summary of dental benefits. I'm going to talk a little bit about the dental PPO program that you're being offered. Again, the company will pay 50% of the cost for you to be on this program, and the contribution worksheet outlines how much it would cost to put your dependents on. The summary of dental benefits starts at the top and illustrates that you have a $2,000 benefit maximum on your plan. This is pretty similar to the benefit maximum that we just talked about on alternative care. It's the amount of money that Kaiser will pay out of their pocket in a calendar year for your services. Preventive and diagnostic services don't count towards that $2,000 maximum, and they're actually provided for free to you. So you get 2 cleanings and routine x-rays per year. If you need to go in for basic services, oral surgery, periodontics, or endodontics, you would have a small deductible of $50, and then you would cover 20% of the cost of the bill if you're in network, and Kaiser would cover 80%. The 80% that Kaiser paid out of their pocket would go towards that $2,000 benefit maximum. In addition, major and removable prosthetic services are covered at 50%, so again it would be subject to the $50 deductible, and then you would split the cost of the remaining bill with Kaiser 50-50. The 50% Kaiser pays would go towards the $2,000 maximum. You'll notice that I mentioned that this was a PPO program and that there's in and out of network coverage. In network, you are basically can be in 4 different places. Inside of a Kaiser facility using the Kaiser Dental Network, or 3 PPO networks that Kaiser contracts with. All 4 of those networks are part of in-network. And inside the brochure in your envelope, there's a gentleman on a phone. This talks about the PPO dental program that they call Choice. If you open up the brochure, You'll see that they have over 320,000 dentists nationwide. There's very good coverage in Clark County and the Oregon area. Over on the right-hand side of the page, where my left hand is, you'll see that it talks about a phone number and a website that you can go to print an ID card, search for dental providers, and view any dental claims. I would encourage you, if you don't have an attachment to a dentist, to start within the Kaiser network. But if you have a relationship with a dentist, check to see if they're part of the other 3 PPO networks, because they may be in network for you. They do have an out-of-network benefit on this plan that's very generous. It's basically the same coverage as if you're in network, but the thing to remember is when you go in for a basic or a major service out-of-network, the dentist will be charging you a retail price instead of what's been negotiated with Kaiser. So the portion that you could pay could be a little bit more. Kaiser does reimburse dentists within 90% of what other dentists would reimburse in that area, so it's very generous, but you definitely get the best bang for your buck by staying in network. I'm going to have you flip over to the back side of the dental page, and I just want to footnote that orthodontics are covered for both adults and children. They're covered at 50% up to $1,000 lifetime maximum. So the lifetime maximum, again, is how much Kaiser would pay out of their pocket in a lifetime. Every person in your family that you pay for to be on the dental program has their own benefit maximum and their own set of benefits. Before wrapping up, I wanted to talk a little bit about the Healthy Together brochure that Kaiser had inside of the envelope. I want to reference a couple pages. The first one is page 2. It talks about registering on kp.org. This is a way that you can establish yourself onto Kaiser's online system. You can make appointments, view results from lab tests, you can email your doctor or set up an appointment, you can pay your bills securely, and many other things. In addition to registering on kp.org, I would encourage you to pick a facility and then a primary care doctor so that you have a doctor assigned to you. You can change that doctor anytime you want, but in the event that you have a situation or an emergency or need to be seen by somebody, at least you will have assigned your primary care doctor. In addition to that, page 2 also talks a little bit about how to set yourself up through Kaiser's online system for renewing prescriptions and also setting up mail orders. So page 2 has a lot of great information on it. In the back of this particular brochure, I like to highlight pages 11 and 12, which show you a map of the Kaiser service area that basically runs along the I-5 corridor from Longview down through Salem and over to Eugene, Oregon. You'll notice that the Kaiser medical facilities are listed with green squares. Those are the hospitals. All of the physician offices are listed with circles. They're going to be blue, and there's a U next to the one that have extended hours for urgent care. In addition to that, you'll see that the Portland Clinic is listed, and there's 6 green dots there. Kaiser entered a relationship with the Portland Clinic a couple of years ago, and all of their facilities are now in-network facilities for Kaiser. So if you'd like to assign yourself a Portland Clinic facility and a Portland Clinic doctor as your primary care physician, it's just like you're inside of a Kaiser facility. You'll notice on the far left-hand side, your right-hand side, are the dental offices. These are Kaiser dental offices, and they're listed in orange. If you're interested in any of the other PPO networks, you would need to reference the PPO brochure that I had shown you. In addition to those facilities, I wanted to mention that Kaiser has opened up a Care Essentials clinic in the Pearl District in Portland. This is a facility that has no Kaiser logo on it, doesn't say Kaiser. Non-Kaiser members can come in off the street and pay cash for services there, but it's a walk-in type clinic. You as a Kaiser member can visit there and simply have a copay. It's an in-network facility, but some of these will be opening up around the Portland area, and although they won't have the Kaiser logo on them, they are Kaiser facilities and they're called Care Essentials. In reviewing, I wanted to make sure that you knew that the due date for turning forms in is Friday, June 23rd. The salary reduction agreement needs to be signed and turned in addition to the Kaiser enrollment form. Once you've turned in both of those items, you would be receiving a new ID card from Kaiser in the mail in probably 2 to 3 weeks. I want to thank you for your time today, and I would like to encourage you to contact my office if you have any questions before Friday or even after. You can ask for me, my name is Kathy, or you can ask for my assistant Elizabeth. I'm going to wrap up the video now, but we're going to give you some contact information if you'd like to call or email us. Thank you and have a great week.